Heartbeat Podcast, your trusted source for the latest breakthroughs and insights in cardiology. Here, we uncover the science behind every beat, bringing you cutting-edge research, expert discussions, and innovative approaches to heart health. Whether you're a medical professional, a curious learner, or someone passionate about understanding the heart's complexities, you're in the right place. So let's dive into today's episode and explore the pulse of modern cardiology together.
Okay, so picture this. You just had a heart attack.
Oh.
You're on the mend, feeling better.
Yeah.
Your doctor says, all right, let's look at your meds.
Okay.
One of them is a beta blocker.
Mm-hmm.
You've been taking it like clockwork. But now you're thinking,
Right.
do I really need to be on this forever?
It's a really common question.
It is. And that's exactly what we're diving into today.
Okay.
Long-term use of beta blockers after a heart attack.
Yeah, a lot of patients ask about this, and honestly, we haven't always had great answers.
Oh, really?
For years, the thinking has been, better safe than sorry.
Right.
Beta blockers just became a standard part of care after a heart attack.
Mm-hmm.
But there's this recent study, the ABYS-SASH trial.
Yeah.
It's giving us some new information
Okay.
that might change how we think about this.
I saw that study in the New England Journal of Medicine.
Mm-hmm.
I knew we had to do a deep dive on it for our listeners.
Yeah, it's a big deal.
It is?
Because it was a large multi-center trial
Okay.
designed to give us some solid evidence about what happens when people stop taking beta blockers after a heart attack.
Exactly. And to really grasp this, we need to start with some basics.
Okay, sounds good.
What are beta blockers?
So beta blockers are medications that block the effects of adrenaline on your heart.
Okay.
You know, that fight or flight hormone
Oh, yeah.
gets your heart racing when you're stressed.
I know that feeling well.
Right.
So after a heart attack,
Yeah.
when your heart's already a little bit vulnerable,
Mm-hmm.
those adrenaline surges aren't exactly helpful?
No, not really.
Okay.
They can strain the heart,
Right.
make it work harder when it needs to be resting and healing.
Okay.
That's where beta blockers come in.
Got it.
They help to slow the heart rate, lower blood pressure,
Okay.
and basically just give the heart a break.
That makes sense.
Yeah.
So historically, beta blockers have been a lifesaver for heart attack patients.
Mm-hmm.
What's changed? Why are we questioning their long-term use now?
Well, one key factor is how we treat heart attacks now has evolved.
Oh, interesting.
Back when we first saw the benefits of beta blockers,
Okay.
we didn't have all these advanced treatments
Right.
like we do now.
Right.
Things like angioplasty and stents,
Yeah.
procedures that open up blocked arteries really fast
Mm-hmm.
to restore blood flow to the heart muscle.
So that's reperfusion therapy.
Yeah, reperfusion therapy, exactly.
Okay.
That wasn't routine back then.
I see.
So patients were at a much higher risk of complications.
Oh, wow.
Beta blockers made a huge difference
Okay.
in improving survival rates.
So it's like the medical landscape has totally shifted.
Exactly.
We have these amazing tools to fix that immediate damage from a heart attack.
Right.
But that makes us wonder,
Yeah,
are the long-term benefits of beta blockers still as important?
exactly. And that's precisely what the ABS trial wanted to figure out.
Okay.
They wanted to see if stopping beta blockers
Right.
in stable patients after a heart attack was non-inferior to continuing them.
Non-inferior, what does that mean?
So in this context, it basically means no worse.
Okay.
So the researchers were asking,
Right.
would taking people off beta blockers
Yeah.
lead to worse outcomes
Okay.
compared to those who stayed on them?
Got it.
To do this, they enrolled over 3,600 patients in France
Okay.
who had a history of heart attack,
Mhm.
but were doing well otherwise.
Okay.
They had good heart function.
So their hearts were pumping well.
Yeah, pumping effectively,
Right.
and they weren't having any recent heart problems.
Got it.
Importantly, these patients also didn't have any other primary medical reason
Okay.
to be taking beta blockers.
So a pretty specific group,
Yeah,
people who had recovered well from their heart attacks?
exactly.
What did they do with these patients in the study?
They randomly assigned them
Okay.
to either stop or continue their beta blocker treatment.
Got it.
Now, it's important to note that this was an open label trial,
Okay.
meaning both the doctors and the patients knew
Right.
who was stopping the medication
Okay.
and who wasn't.
All right.
Then they followed these patients for an average of about 3 years
Okay.
to see what happened.
And they were looking for any differences in cardiac events between the two groups.
Exactly.
What does that mean?
So the primary endpoint of the study
Okay.
was a combo of several events.
Okay.
Death from any cause non-fatal heart attack, non-fatal stroke, or hospitalization for any heart-related reason.
Okay.
They put all these events together into one outcome, which is called a composite endpoint.
Okay, so they were tracking if patients had any major heart issues during follow-up.
Yes, regardless of the specific type of event.
Got it.
Here's where things get interesting.
Okay.
They found that stopping beta blockers was not non-inferior to continuing them.
So that means?
This means that the group who stopped the medication might have been at a slightly higher risk of having one of those events.
Wait, so stopping beta blockers might actually be riskier?
Yeah, I know. It seems counterintuitive, right?
It does.
But it's important to really look at what the numbers tell us.
Right.
The event rate in the group that stopped beta blockers was 23.8%.
Okay.
While the rate in the group that continued taking them was 21.1%.
So, yeah, there's a difference,
Well,
but
it's not huge.
Right. And you said before that this difference wasn't statistically significant.
Right.
So what does that mean?
It means that while there was a small increase in risk for those who stopped beta blockers, it wasn't a large enough difference to say for sure
Got it.
that it was because of the change in medication.
Oh,
It could have been due to chance
right.
or other things we don't fully understand.
So it's not like everyone who stops is going to have another heart problem.
Exactly.
It just means there's a potential risk that needs to be weighed against the potential benefits of stopping.
Precisely.
And that's where talking to your doctor is key.
Absolutely. A crucial conversation.
But before we get into that, let's talk about another interesting finding from the ABYS trial. Okay, so we've talked about the potential risks.
Yeah.
But the ABABAS trial also looked at the impact of stopping beta blockers on quality of life, right?
They did.
I mean, you'd think taking fewer medications would make people feel better overall.
You would think so, right?
Yeah.
But the results were a bit surprising there, too.
Really?
They used a standard questionnaire. It's called the EQ5D to measure quality of life.
Okay.
And they found that stopping beta blockers didn't actually lead to any significant improvements.
Wow. That's unexpected.
Yeah.
It seems like this trial is really challenging a lot of our assumptions.
It is.
About beta blocker use after a heart attack.
It's definitely giving us a lot to think about.
Yeah. And there's one more piece of this puzzle we need to look at.
Okay.
The researchers noticed a possible increase in angina.
Right.
That's chest pain.
Right.
From reduced blood flow to the heart.
Yeah.
And coronary-related hospitalizations in the group that stopped beta blockers. So even though the main findings about those cardiac events weren't statistically significant, there were some signs that stopping beta blockers might lead to more heart problems.
Yeah. And while those specific observations weren't statistically tested in this trial, they do bring up some interesting questions.
Like what?
Well, it's possible that even in stable patients, beta blockers might be offering some ongoing protection against things like angina. We call these residual benefits, meaning benefits that go beyond that initial recovery period after a heart attack.
So residual benefits?
Yeah.
It makes you wonder if we've been underestimating the long-term impact of these meds.
It's possible.
If that's the case, wouldn't that mean everyone who's had a heart attack should just stay on beta blockers forever? Just in case?
Well, that's a valid concern, and it highlights why we need more research to figure out who really benefits from long-term beta blocker therapy.
Got it.
The ABYSS trial gives us some clues, but it doesn't give us the whole picture.
Right. You mentioned before that there are other ongoing trials looking at beta blockers after a heart attack.
That's right.
Can you tell us a bit more about those?
Absolutely. One that's relevant is called REDUCE-AE. This one focused on a different group of patients. Those who started taking beta blockers during their heart attack rather than after.
So a slightly different scenario.
Yes, a bit different from ABOBS. They wanted to see if continuing those beta blockers long-term actually made a difference for this group.
Interesting. What did they find?
Well, REDUCE-AMI found that continuing those oral beta blockers in this group didn't necessarily lower the risk of death or another heart attack.
So in this case, long-term beta blocker use didn't seem to provide extra protection.
Right. It didn't seem to add much benefit in this particular group.
So that kind of goes against the idea that everyone needs to stay on them long-term.
Yeah, it definitely suggests that the timing of when you start the medication
might be important.
It could play a role.
Yeah, it adds another layer of complexity to deciding what to do.
Right.
Then there's another trial called Smart Decision. Which is taking a different approach.
How so?
They're looking at whether it's safe to stop beta blockers in patients with stable coronary artery disease.
Okay, so that's narrowing of the arteries that supply blood to the heart.
Exactly.
Got it.
And they're focusing on patients who are considered low risk.
So a specific group.
Yeah.
Who might be good candidates for stopping beta blockers.
Right. They're trying to identify those who might not need them long term.
It seems like there's a real effort to personalize treatment.
Absolutely.
Based on individual risk factors and needs.
Yeah.
Rather than this one-size-fits-all approach.
Exactly.
Yeah.
We're moving away from that idea.
Yeah.
That everyone needs the same meds for the same amount of time.
Makes sense.
We're trying to tailor treatment to each patient's specific situation.
That makes a lot of sense.
But with all this new research coming out, it's easy to feel a bit lost.
I know, it can be overwhelming.
If I'm listening to this and I'm thinking about my own medications, what's the main takeaway?
I'd say the most important thing is don't rush to any decisions.
Okay.
Based on just one study.
So don't panic and throw out your pills.
No, not at all. The ABYS trial gives us some valuable info.
Yeah.
But it doesn't mean everyone should stay on beta blockers forever.
So what should people do?
The best thing to do is talk to your doctor.
Okay.
They know your medical history.
Right.
They can help you weigh the pros and cons of continuing or stopping beta blockers.
So it's a conversation.
It's not a decision you make on your own.
Right.
Your doctor can explain the research, answer any questions you have.
Okay.
And work with you to come up with a plan.
Right.
Right for you.
So it's all about shared decision-making.
Exactly.
Which gives patients a voice in their own care.
That's the goal.
Now let's play devil's advocate for a second. What if the ABYS trial had found the opposite?
Interesting.
What if it had said stopping beta blockers was totally safe?
Okay.
And didn't increase the risk of heart problems?
That's a great question.
How do you think that would have changed things?
If that had been the case, it's very possible we would have seen a big shift in practice.
Okay.
Doctors might have been more comfortable taking patients off these meds.
So potentially fewer people on beta blockers long term.
Yeah, that's possible.
Which could have big implications for everything.
Yeah.
From prescribing patterns to healthcare costs.
Exactly. It could have had a ripple effect throughout the system.
Wow, it's amazing to think.
It is.
How one study can have such a big impact.
It shows you the power of research to change our understanding of medicine and guide us to better care for patients.
It also emphasizes the importance of staying informed.
Yeah.
But also understanding that research is always ongoing.
That's key.
What we know today might change as we get new studies.
Absolutely. It's a constantly evolving field.
Right. So stay curious.
Yeah.
Keep asking questions and talk to your healthcare providers.
That's the best way to stay on top of your health.
It's wild to think how much we've learned about heart health.
I know, right?
Even just in the last few decades.
Yeah, it's amazing.
And it seems like with every new study, we get more questions than answers.
It's true. The more we learn, the more we realize we don't know.
Right.
But that's what makes it so interesting. Always something new to discover.
Exactly. And the ABS trial is a great example.
Yeah, for sure.
It challenged some of those old ideas about beta blockers and opened up this whole new area for research.
Definitely.
I think the biggest takeaway from all of this is that there's no one-size-fits-all answer.
Right.
When it comes to using beta blockers after a heart attack.
It's not that simple.
What works for one person might not work for someone else.
Right. And individual factors are so important.
So it's not just heart attack equals beta blockers for life.
No, not anymore.
There's more to it than that.
Absolutely. We're moving towards a more personalized approach in medicine.
Okay.
Especially in cardiology.
Got it.
We're starting to understand that the timing of treatment, how severe the heart attack was, the patient's overall health.
Yeah.
All these things can affect how long they might need those beta blockers.
That makes sense.
Yeah.
So for our listener out there who's maybe a little unsure about their own beta blocker prescription, what's the best thing to do?
I'd say talk to your doctor.
Okay.
They're the ones who know your medical history.
Yeah.
And they can help you figure out the benefits and the risks of staying on or stopping the beta blockers.
So it's a conversation.
It is you and your doctor working together.
Not a decision you make on your own.
Exactly.
Your doctor can explain all the latest research, address any concerns you might have, and help you come up with a plan.
A plan that works for you.
That fits your needs.
That's the goal.
It's all about shared decision making.
Right.
Giving patients a voice in their own care.
Absolutely.
Now, before we go, I want to leave our listener with one last thought.
Okay.
Let's go back to that scenario we talked about.
Yeah.
What if ABYS had found the opposite?
Interesting.
What if they said stopping beta blockers was totally safe?
Okay.
No increased risk of heart problems.
Yeah, all right.
How do you think that would have changed things?
Well, I think we might have seen a shift in how doctors practice.
Okay.
They might be more likely to stop beta blockers in stable patients.
So fewer people taking them long term.
Yeah, potentially.
Which could have a domino effect
Yeah.
on prescribing patterns, healthcare costs.
Absolutely. It could have touched every part of the system.
Wow. So one study can really change the game.
It really shows the power of research to change how we think about medicine.
Yeah. And how we care for patients.
Exactly.
It reminds us that research is always changing.
It's an ongoing process.
And what we know today might be different tomorrow.
That's why it's so important to stay curious.
Right. Keep learning.
Ask questions.
And talk to your healthcare team.
They're your best resource.
Well, that brings us to the end of our deep dive.
It was a good one.
We hope you found this exploration of beta blockers helpful.
Yeah, a lot of good info.
And remember, knowledge is power.
Absolutely.
But it's even more powerful when you combine it with personalized medical advice.
Talk to your doctor.
So keep those conversations going with your doctor and stay curious about your health.
Exactly.
Till next time, happy diving.
Thank you for tuning in to the Heartbeat Podcast, where we uncover the science behind every beat. If you enjoyed this episode, don't forget to subscribe to the podcast on your favorite platform to stay updated with our latest discussions and insights. We'd love to hear from you. Share your thoughts, feedback, or questions, and let's continue exploring the pulse of modern cardiology together. Until next time, take care, stay curious, and keep your heart healthy.